Welcome to this video on using the Readiness assessment tool to assess suitability for the NHS low-calorie diet programme. My name is Dr. Paul Chadwick and I'm a consultant clinical and health psychologist and clinical director of Momentum Newcastle. So let's start by thinking about what the NHS low-calorie diet programme is and why we need a tool to assess readiness for it. So the NHS Low Calorie Diet Programme is a structured weight management programme to support the management of type 2 diabetes. Low calorie diets, or LCDs, are known to be very effective, but they do require considerable commitment and motivation on behalf of the patient if they're going to work. And so because of this, it's really important to ensure that there's a good match between a patient's level of motivation and the demands of the programme. Mismatches here will lead to people dropping out of the programme, which will be not only unhelpful for the patients, but means that NHS resources are used less effectively than we would like. The Low Calorie Diet Readiness Assessment tool has been designed to help patients and healthcare professionals work together to decide whether the low calorie diet programme is suitable for them on the basis of their clinical history, a patient's treatment preferences and their current circumstances. The tool has been designed to use within the context of a clinical consultation or as part of a wider initiative to invite patients to participate in the programme. The tool is based on the principle of self-assessment and looks at 7 constructs that are known to predict adherence and response to dietary interventions within the weight management literature. This slide shows the 7 questions that form the basis of the tool. Potential participants are asked to indicate the degree to which they agree with 7 statements relating to adherence and suitability of a low-calorie diet programme. Patients who believe that they will be able to stick to a low-calorie diet programme for 12 weeks are more likely to be able to achieve this. If patients strongly disagree that this is something that they would be able to do, it is unlikely that the programme will be a good match for them at this time. In order to stick to a low-calorie diet programme for 12 weeks, patients have to believe that doing so will benefit their health and their diabetes specifically. Also, low-calorie diets are best suited to those who want to make long-term lifestyle changes rather than using the low-calorie diet part of the programme as a quick fix to be endured and then to return to normal eating habits. Participants will be expected to stay on the programme for a year, not just the 12 weeks of the low-calorie diet phase. Research shows that following a low-calorie diet requires a lot of support from close friends and families. Individuals who live in circumstances or households where other people are likely to sabotage their efforts may not do so well on this programme. Sticking to a low-calorie diet for 12 weeks requires a great deal of dedication, commitment and focus. Individuals who have very complex life circumstances, who experience high degrees of stress, may not have all the psychological resources at that time to focus sufficiently on the low-calorie diet. This would lead to low levels of adherence and disappointment in the programme. In such cases, where individuals experiencing high levels of stress, it may be better to defer referral to the programme until circumstances are less complex, less stressful and more conducive to success. This low-calorie diet programme is delivered in a group format, so it's important that this kind of approach is suitable and acceptable to the patient. And then finally, although low-calorie diets are safe for most people, they are not suitable for individuals with significant clinical histories of eating disorders or disordered eating. We will talk about how to assess this and talk to patients about it later. Potential participants are asked to read the statement and tick or circle the response that most accurately indicates the level of agreement. Responses that fall within the white boxes of the tool indicate a good fit for the programme at this moment in time. Responses that fall within the grey boxes of the tool suggest that there may not be a good fit for the programme at this particular moment in time. Participants who are likely to commit and benefit from the programme will have more white box answers than grey box answers, and the more white box answers, the greater the likelihood of a good match between the individual and the programme. There is no absolute cut-off score for this tool, as it is not a screening tool. It's a tool to support clinical decision making in the context of a clinical consultation. Once the potential participant has filled out the tool, you can begin the process of exploring their answers. When doing this, it's helpful to frame the discussion of the participants' answers in terms of wanting to understand the best way to support them with their diabetes management. It can be helpful to stress that this is about working out if this is the right intervention at the right time for the person in front of you. It can be helpful to follow up participants' answers. Answers that fall within the grey boxes represent potential barriers for participation, and it can be helpful to explore the reasons why a participant answered in this way. For example, can you tell me why you disagree about whether other people would support you? It can also be helpful to follow up questions where patients have answered in the white boxes. For example, if you feel that a patient has underestimated their readiness, this can be a cue to explore this in more detail. Question 7 specifically examines the likelihood of the low-calorie diet program having negative impact on an individual. Low-calorie approaches have been criticised in recent years for creating psychological harm, such as eating disorders. However, the scientific evidence on the psychological impact of low-calorie diet programs does not support these concerns. Systematic reviews of the impact of supervised low-calorie diet programs suggest that participation in such programs are generally associated with improvements in most psychological outcomes. Nevertheless, no intervention works for everybody, and it is also the case that for some people this approach may not be effective and could cause an increase in weight-related distress. Question 7 is designed to identify and explore these individuals. Psychological science is not yet sufficiently clear on how to predict who will experience distress as a result of participating in a low-calorie diet approach. However, what science exists and clinical expertise suggests that the following indications may be helpful. Firstly, if the person themselves feels that the program will have a negative impact, then that might be a reason not to refer into the program. For example, if a person really stresses that they think following a low-calorie diet program with no food for 12 weeks will cause them to experience significant levels of depression or distress, then one should trust this, and they would probably not be a good candidate for the program. A patient's clinical history may be relevant here also. If there is a clinical history of binge eating, and that might be of clinical or subclinical significance, extreme dietary restriction that's associated with physical or psychological harm such as anorexia, or behaviours such as binging and purging, as one would see in bulimia, then all of these may be contraindications to the program. It may be the case that some individuals indicate a strong preference to take part in the program despite the presence of significant concerns about harm. If this is the case, then it is unlikely to be helpful or beneficial to the patient to refer them into the low-calorie diet program, but it might be more appropriate to refer such individuals for individualised, specialised support if this is available in your local area. So, a summary. The low-calorie diet readiness assessment tool is there to support patient-centred discussions about treatment preferences for weight management in the context of type 2 diabetes. It helps individuals with type 2 diabetes and the health professionals that look after them to think together about whether a low-calorie diet approach will be effective, acceptable and safe for a given individual given their history and current circumstances. A patient's answers to the items on the tool can be used as a clue to explore barriers and facilitators to weight management using a low-calorie diet approach, all the while making use of principles of patient-centred communication. The low-calorie diet readiness assessment tool is owned by Memento Newcastle, and permission to use the tool as well as more information and further training can be found by contacting Dr. Paul Chadwick at Memento Newcastle.